Hello, seniors. I am Dr. Robert Harrison. Your feet feel like they're on fire at night. You wake up and your toes are numb. Tingling shoots up your legs when you stand. You've been to doctors. You've heard the words peripheral neuropathy, and you've probably been told it's just aging or it's genetic or there's nothing you can really do about it. But what if I told you that research published in major medical journals points to one specific metabolic toxin that may be quietly damaging your nerves right now, and most people have no idea their body is producing it? This isn't about pesticides or heavy metals. This is a toxin your own body creates when certain eating patterns trigger specific chemical reactions. And according to studies, up to 67% of people with unexplained neuropathy share one common metabolic pattern that causes this toxin to accumulate in nerve tissue. I'm going to reveal the 5 hidden sources that cause your body to produce this nerve-damaging toxin. And number 1 is so common, you've probably triggered it multiple times already today without knowing it. But first, drop a comment with your age and whether you're experiencing burning, tingling, or numbness in your hands or feet. Your answer helps me understand who needs this information most. The toxin I'm talking about has a scientific name: advanced glycation endproducts, or AGEs. These are toxic compounds that form when sugar molecules bind permanently to proteins in your body, including the proteins that make up your nerve fibers. Research published in Diabetologia has shown that AGEs accumulate in nerve tissue and directly contribute to neuropathy progression. Picture this scenario. Someone eats in a way that keeps their blood sugar elevated for hours after meals. During that time, sugar molecules are floating through their bloodstream, colliding with proteins, sticking to them, and creating these toxic AGE compounds. Those compounds then deposit in nerve tissue, in the protective coating around nerves, and in the tiny blood vessels that feed nerves. Over months and years, this accumulation causes the exact symptoms you're experiencing: burning, numbness, tingling, and progressive nerve damage. Here's what makes this particularly insidious. Your body can't easily break down or remove these toxins once they form. They accumulate, and the more your blood sugar spikes and stays elevated, the faster you produce them. According to research in the Archives of Internal Medicine, seniors with peripheral neuropathy have significantly higher rates of falls, loss of balance, and inability to perform daily activities independently. The numbness makes it impossible to feel where your feet are. The weakness makes stairs dangerous. The burning pain disrupts sleep, which affects cognitive function, mood, and overall health. And here's the urgent part. Research published in the Journal of Diabetes and its Complications found that once age accumulation reaches a certain threshold in nerve tissue, the damage becomes extremely difficult to reverse. Some studies suggest there's a window, often in the early stages of symptoms, where stopping the toxin production can prevent further progression. But that window closes. The longer these toxins accumulate, the less responsive nerves become to intervention. Most people don't realize they're in this critical window until it's already closing. Now, I know what you're thinking. This sounds terrifying. If my body's been producing this toxin for years, is it too late? And that's exactly where most doctors leave you, sitting in that fear with no answers. But research from multiple institutions, including work published in Diabetes Care, has shown something that completely changes this conversation. When people modify specific eating patterns, age formation in the body can drop by measurable amounts within weeks, not months. Weeks. We're not talking about experimental drugs or expensive treatments. We're talking about understanding how your body produces this toxin and turning off the tap. And here's the part that nobody talks about. Everyone's been focused on cutting out foods. Don't eat this, avoid that. But the research points to something different. How you combine foods and when you eat them appears to matter more than which specific foods you choose. Your morning toast isn't the enemy. Eating that toast by itself at 7 a.m., then snacking at 9, then eating again at 11, that pattern is what's creating the problem. If you understand the mechanism, you can work with your body instead of against it. Let me walk you through the 5 patterns that research shows accelerate age production in your body. And I'm starting with number 5 because it's probably the one you'll find easiest to fix. Most people don't think about when they stop eating. Breakfast at 6 hour, snack at 9, lunch at noon, another snack at 3, dinner at 6. then maybe fruit or yogurt at 8:30 while watching TV. 15–16 hours of eating spread across the day. And research published in Cell Metabolism shows this creates a problem most people never connect to their nerve pain. Every time you eat, particularly anything with carbohydrates, your blood sugar rises. That elevated blood sugar is the environment where sugar molecules start binding to proteins and forming ages. When you eat every 2 to 3 hours from morning until night, you're keeping blood sugar elevated for that entire 15–16 hour window. Your body never gets a break. It's producing these toxic compounds continuously. The researchers compared two groups. Same food, same total calories. The only difference was timing. One group ate across 15 hours. The other group compressed all their eating into 10 hours. The 10-hour group showed lower markers of age accumulation in their blood tests. They weren't eating less. They were just giving their body extended hours where blood sugar could drop to baseline and toxin production could slow down. Let me give you a real-world example of how this works. Someone wakes up at 6, has coffee with creamer. That starts the clock. They eat breakfast at 7:30, snack at 10 DU, lunch at 1 B, another snack at 4 CU, dinner at 7, then ice cream at 9 BUs while watching the news. They've just maintained elevated blood sugar for 15 hours straight. Now imagine they shifted everything. Same meals, same snacks, but compressed between 8 a.m. and 6 p.m., 10 hours. They've just cut their daily toxin production window by 5 hours. Over weeks, over months, research suggests that adds up to measurably less age accumulation in nerve tissue. You can start this today without changing a single food you eat. Just change when you stop. If you currently eat across a 14 to 16 hour window, begin narrowing it gradually. Stop eating by 7 p.m. as a first step. Then, if comfortable, delay your first meal by an hour. Aim for a 12-hour window initially, which many people find sustainable. Then, consider narrowing to 10 hours if your schedule allows. Anyone taking diabetes medications, blood pressure medications, or insulin must consult their healthcare provider before changing meal timing. Medication dosing is often calibrated to specific eating schedules, and changes can cause dangerous blood sugar or blood pressure fluctuations. People with a history of eating disorders should also approach time-restricted eating only under medical supervision. Now, this next one catches people completely off guard because it seems unrelated, but stay with me because the connection is stronger than you might think. Research published in JAMA tracked thousands of people taking proton pump inhibitors. Those are the purple pill, the little pink pill, the medications doctors prescribe for heartburn and acid reflux. And what they found was that long-term use, we're talking years, was linked to vitamin B12 deficiency. You might be wondering what B12 has to do with nerve toxins. Everything, actually. Your body has a detoxification system. It's constantly trying to break down and remove these age compounds we've been talking about. One of the primary pathways for that detox process requires B12. It's called methylation. And without adequate B12, that pathway slows down. So you're not just producing more toxins from elevated blood sugar, you're also losing your ability to clear the ones you're making. They accumulate faster. And there's a second hit. B12 is essential for maintaining myelin, which is the protective coating around your nerve fibers. Think of it like insulation on electrical wires. When B12 drops too low, that insulation deteriorates. Now your nerves are both exposed to more toxins and less protected against them. The mechanism makes perfect sense once you understand it. Stomach acid is required to separate B12 from the proteins in food so your body can absorb it. These acid-blocking medications reduce stomach acid by up to 90%. You can be eating plenty of meat, eggs, and dairy, all rich in B12. But if your stomach can't process it, you're not absorbing it. Over years, your stores deplete. Here's what happens in real life. Someone's been on one of these medications for 5, 6, 7 years. Their diet's fine, they eat well, but nobody's checked their B12. They start developing tingling in their feet, numbness in their hands. 3 doctors evaluate them. Everyone assumes it's aging or early diabetes. Nobody connects it to the heartburn pill they take every single morning. And here's the kicker. Standard lab testing calls B12 levels normal if they're above 200 picograms per milliliter, but research suggests that for neurological health, for protecting nerves and supporting detoxification, you want levels above 500. Someone can be technically normal at 250 and still be setting themselves up for nerve damage. If you've used acid-blocking medications for more than 1 year, ask your healthcare provider to check your B12 level with a blood test. Discuss whether you still need the medication or if alternatives exist. Consider sublingual B12 supplements, which dissolve under the tongue and bypass the need for stomach acid, but only under medical guidance. Never stop prescribed acid-blocking medications abruptly without medical supervision, as rebound acid production can be severe. Some conditions, including Barrett's esophagus and certain ulcers, require acid suppression. Work with your healthcare provider to weigh the risks and benefits. B12 supplementation can interact with certain medications, including metformin, and can mask symptoms of other deficiencies. So, medical oversight is essential. All right, number 3 is going to be uncomfortable for some of you, and I get it, but the research on this is too clear to ignore. Fruit juice, smoothies, those green drinks everyone says are so healthy. From a nerve protection standpoint, research published in the American Journal of Clinical Nutrition shows these are among the worst things you can consume. And before you think I'm being dramatic, let me show you what the science actually found. They took 2 groups. One group ate whole oranges, the other group drank fresh squeezed orange juice, same oranges, same total sugar, but the juice group's blood sugar spiked 40 to 60% higher. And when they measured markers of age formation afterward, the juice group was producing these toxic compounds at a significantly faster rate. Why? Fiber. When you bite into an apple or peel an orange, you're getting fiber that acts like a physical barrier in your digestive system. Sugar releases slowly as your body breaks down the fruit over 1, 2, sometimes 3 hours. Your blood sugar rises gradually, moderately, then comes back down. When you drink that same fruit as juice, there's no barrier. All the sugar from 3 or 4 oranges hits your bloodstream in 10-15 minutes, and that creates exactly the environment where ages form fastest. Think about how age formation works. You need sugar molecules floating in your blood to collide with proteins and bond together. The higher the concentration of sugar, the more collisions, the more toxic compounds you create. A gentle gradual rise, some age formation, manageable. A sudden spike to high levels, exponential acceleration of toxin production. And here's what makes this pattern so common. Many seniors were told by doctors, by family, that juice is an easy way to get nutrients, especially if chewing is difficult or appetite is low. Smoothies got marketed as health foods. Blend up some berries, some spinach, call it wellness. But from a blood sugar perspective, you've just created a sugar bomb with no fiber to slow it down. Your body sees it the same way it sees soda. Research even showed that when people ate fruit whole, especially after a meal with protein, the blood sugar impact was minimal. An apple after lunch with chicken, barely a blip. That same apple blended into a smoothie on an empty stomach, massive spike. Eliminate all liquid sugar sources. No fruit juice, no sweetened beverages, no fruit smoothies. If you want fruit, eat it whole in small portions, ideally after a meal that includes protein. This single change can reduce blood sugar spikes by 30 to 50% in some individuals, according to research on glycemic variability, directly translating to reduced toxin production. For people with difficulty swallowing, severe digestive conditions, or conditions requiring liquid nutrition, work with a healthcare provider or registered dietitian to find alternatives that meet nutritional needs without triggering excessive age formation. Some medical situations require modified approaches. This one, I see it constantly, and once you understand it, you'll see it everywhere too. Toast for breakfast, just toast, maybe with jam. Crackers as an afternoon snack, a bowl of pasta for dinner without much else. Rice as a side dish by itself. Each of these seems harmless, right? But research published in Diabetes Care measured what happens when you eat carbohydrates alone versus pairing them with protein or fat. The difference was staggering. Carbohydrates alone, blood sugar spiked 2 to 3 times higher. Same carbohydrates with protein or fat, the spike was cut by 40, sometimes 60%. And with that reduction in blood sugar spike comes a direct reduction in age formation. We're talking about the same food creating dramatically different outcomes just based on what you eat with it. The science behind this is actually pretty straightforward. Protein and fat slow down your digestion. They make food sit in your stomach longer before releasing into your bloodstream. So instead of a flood of sugar all at once, you get a slow, steady release over hours. For your nerves, this is the difference between a chemical assault and a manageable, stable environment. Let me show you what this looks like in practice. Someone eats 2 slices of toast with jam for breakfast. Only carbohydrates. Within 45 minutes, their blood sugar's gone from 90 to 175. Now imagine they eat the same exact toast with scrambled eggs and half an avocado. Their blood sugar peaks at 125. Same bread, same jam, but a 50-point difference in the spike just from adding protein and fat. According to research on age formation, that 50-point difference translates directly to measurably less toxin production. You're eating the same amount of food. You're not going hungry. You're just combining it in a way that protects your nerves. The challenge is so many traditional eating habits were built around carbohydrates as the center of the meal. Cereal with milk for breakfast, a sandwich for lunch, crackers when you want a snack, each one creating that isolated carbohydrate spike that research now directly links to nerve damage. And because it's been normal your whole life, it never occurred to you that the pattern itself was the problem. Never eat carbohydrates alone. Every meal and every snack must include protein or healthy fat. Bread, add eggs, cheese, or nut butter. Crackers, pair with hummus or cheese. Oatmeal, add protein powder, nuts, or Greek yogurt. Rice or pasta, serve with substantial protein. This becomes automatic within about 2 weeks of consistent practice. People with kidney disease must monitor protein intake carefully and should work with a nephrologist or renal dietitian before increasing protein consumption. Anyone with food allergies, particularly to common protein sources like nuts, eggs, or dairy, needs to identify safe alternatives. Individuals with specific dietary restrictions for medical or religious reasons should adapt this principle within their guidelines. And now we get to number 1. This is the pattern that changes everything, and it's the reason most people with nerve damage never knew they were at risk until it was too late. Your doctor orders a fasting blood sugar test. You don't eat for 12 hours. Go in first thing in the morning. They draw blood. Results come back at 95. Normal. Your doctor tells you you're fine. Everything looks good. And you walk out believing your blood sugar isn't a problem. But here's what research published in JAMA Neurology found. 40% of people with confirmed peripheral neuropathy had completely normal fasting blood sugar. Normal. And yet their nerves were deteriorating. How is that possible? Because fasting blood sugar only shows you the lowest point. It doesn't show you what happens after you eat. And that's where the real damage occurs. Studies in diabetes care have shown that post-meal blood sugar, what happens at the 1 hour and 2 hour marks after eating, is more predictive of nerve damage than fasting levels. But almost nobody gets tested for it. So what's actually happening? You eat breakfast, your blood sugar spikes to 175, stays elevated at 150 for 2, 3, sometimes 4 hours, then it finally comes back down. You eat lunch, same thing. Dinner, same thing. 3 times a day, every single day, your blood sugar is surging into ranges that research associates with rapid age formation. But because fasting tests only measure the valley between those peaks, it never gets detected. Research published in Diabetologia found that people with what's called impaired glucose tolerance, where post-meal sugars are elevated but fasting levels stay normal, already show measurable nerve dysfunction in detailed testing. This is happening before diabetes gets diagnosed, before most people have any clue there's a metabolic problem. Think about what this means. Someone goes in for their annual physical every year, gets told their fasting glucose is fine, 92, 95, 98, all normal. Meanwhile, after every single meal, their glucose is hitting 170, 180, staying there for hours. Their body is producing nerve toxins at an accelerated rate 3 times a day for years. And the standard medical system never caught it because they only tested the wrong number. The American Diabetes Association now recommends hemoglobin A1C testing, which measures your average blood sugar over 3 months. Anything above 5.7 suggests pre-diabetes and increased risk for age accumulation. That's better. It catches some of these patterns. But even A1C is just an average. It still doesn't show you the actual spikes where toxin production happens fastest. Ask your healthcare provider for a hemoglobin A1C test. If it's above 5.7, request post-meal glucose testing. Consider using a continuous glucose monitor or fingerstick testing for 2 weeks to see your actual patterns. Research suggests blood sugar should stay below 140 at the 1-hour mark after eating and return below 120 by 2 hours. Higher levels indicate the pattern associated with accelerated age formation and nerve toxin accumulation. Glucose monitoring provides information, not diagnosis or treatment. Work with your healthcare provider to interpret results and determine appropriate interventions. Never adjust diabetes medications based on self-monitoring without medical guidance. Some people may experience anxiety from frequent monitoring. If this occurs, discuss alternative approaches with your healthcare provider. Here's what's interesting about this nerve toxin and the 5 triggers we've discussed. The research is published, it's in major medical journals. Scientists understand the age formation pathway and its connection to neuropathy. But this information doesn't fit neatly into standard 15-minute medical appointments. Doctors are trained to diagnose and treat established diseases. Prediabetes, early metabolic dysfunction, and subclinical age accumulation don't always trigger immediate treatment protocols. By the time someone reaches diabetes diagnosis, research suggests significant nerve damage may already be present. The opportunity for prevention exists years earlier, but the healthcare system isn't structured to catch it at that stage. Additionally, discussing meal timing, food combinations, and post-meal glucose patterns requires patient education time that most medical practices can't accommodate. It's easier to prescribe a medication than to teach the underlying mechanisms and behavioral strategies. If you're someone who values understanding these connections and taking informed action before irreversible damage occurs, you're more informed than most people walking out of their doctor's office. That's not an exaggeration. Let me bring this together with clarity. The worst toxin harming your nerves and causing neuropathy is advanced glycation end products, or AGEs. These toxic compounds form when elevated blood sugar causes sugar molecules to permanently bind to proteins in your nerve tissue. Once formed, they accumulate, causing the burning, tingling, numbness, and progressive damage that characterizes peripheral neuropathy. The 5 triggers we've discussed, the constant eating pattern, the vitamin B12 depletion cycle, the liquid sugar flood, the isolated carbohydrate pattern, and the post-meal toxin surge you've never measured, all share one common thread. They create the elevated blood sugar environment where age formation accelerates. Here's what gives me hope for you. While you can't easily remove ages once they've formed, you can stop producing new ones. Research shows that when people implement the strategies we've discussed, markers of age formation in blood tests decrease within weeks. That means less ongoing damage. That means preserving the nerve function you still have. Your action plan, designed to be practical and sustainable. Week 1. Eliminate all liquid sugar. This creates the fastest measurable reduction in age formation according to research on glycemic control. Week 2. Implement the never eat carbohydrates alone rule. Every meal, every snack must include protein or fat. Week 3. If you're currently eating across a 14 to 16-hour window, begin narrowing it to 12 hours. Stop eating by 7 p.m. and delay breakfast slightly if comfortable. Week 4. Get your vitamin B12 and hemoglobin A1C tested. If you're on acid-blocking medications, discuss alternatives with your doctor. One additional step that research strongly supports: walk for 10 minutes after your largest meal. Studies published in Diabetes Care found that even brief post-meal walking significantly reduced blood sugar spikes, directly translating to reduced age formation. It doesn't have to be vigorous, just moving. These aren't guarantees. Individual responses vary based on genetics, current health status, and how long ages have been accumulating. Some people notice symptom improvements within weeks. Others may experience stabilization without dramatic improvement. Both represent success because preventing further toxin accumulation preserves independence and quality of life. Here's my challenge to you. Pick one trigger from this video, just one. Eliminate it consistently for 14 days. Then come back and tell me what you noticed. Did your burning decrease? Did your balance improve? Did you sleep better? Your experience matters because it helps others decide whether to try these strategies themselves. If this information revealed connections you hadn't considered before, subscribe for more evidence-based content every week. I read every comment, and your questions directly shape what I cover next. And speaking of what's next, here's what I'm covering in the next video. The 5 vitamin deficiencies that mimic dementia symptoms in seniors and why standard testing often misses them completely. Number 3 involves a nutrient that over 60% of seniors are deficient in according to research, and it affects memory, mood, and physical coordination. The symptoms look like Alzheimer's, but they're potentially reversible. You won't want to miss it. Take care of yourself. Your nerves deserve protection, and you deserve accurate information that respects both the science and your intelligence.